Welcome to Global Health Guide, your trusted source for understanding healthcare and insurance systems around the world. Today, we're diving deep into one of the most important and frequently asked questions in the UK. Is private health insurance really worth it in 2025, or is relying on the NHS still the better choice? With rising medical demands and changing lifestyles, this topic is more relevant than ever. Make sure to watch till the end for an honest and practical breakdown, and if you care about your health and your wallet, don't forget to subscribe to the channel and hit that bell icon. Let's begin by looking at how healthcare in the UK is shifting in 2025. The NHS, or National Health Service, remains the backbone of public healthcare, funded through taxes and offering care free at the point of service. It's a system admired around the world, but like all systems, it's facing major challenges. Waiting times are longer than ever, staffing shortages continue, and the system is under constant pressure. As a result, more and more people are considering whether private insurance is the answer. At the same time, the cost of living is rising, and many families are asking themselves, is paying for private cover a smart move, or just an extra burden? Now let's look at what the NHS still offers. To be fair, the NHS has saved millions of lives over the decades. It offers free GP services, emergency treatment, specialist care, and surgeries all without direct charges. You don't have to worry about surprise bills, monthly premiums, or whether your doctor accepts your insurance. But there's a catch. The NHS is overloaded. Getting an appointment might take weeks. Some non-urgent surgeries are delayed for months, and during times of crisis like the recent COVID waves, NHS hospitals have been overwhelmed. You get great care, but sometimes, you have to wait a long time for it. On the other hand, private health insurance offers a completely different experience. Big-name providers like Bupa, AXA, and Vitality promise faster access to specialists, private hospital rooms, and shorter waiting times. You can choose your own doctor or hospital, and often get treated within days, not months. Many private plans also include extras like mental health services, physiotherapy, or dental care, which the NHS doesn't always provide. The experience is often smoother, faster, and more personalized, but as expected, all of this comes at a cost. So let's talk money. On average, private health insurance in the UK costs anywhere from £30 to £100 per month depending on your age, health, and level of coverage. That means over £1,000 a year for a family plan, and even with insurance, you might still need to pay in excess of fixed amount per claim or face restrictions on pre-existing conditions. Not every treatment is covered, and policies can be confusing if you don't read the fine print. So while you're definitely paying for better access and comfort, it's important to understand what your money really buys. To make it clearer, let's compare two real-life examples. Meet Emily. She uses the NHS. She needs a non-urgent knee surgery. It's scheduled 4 months from now, but she pays absolutely nothing. Meanwhile, James has private insurance. He gets the same surgery in just 2 weeks, in a private hospital, with a private room, but he pays £70 a month for his plan, plus a £200 excess charge for the procedure. Both recover well, but their journeys are very different. So who made the better decision? Honestly, it depends entirely on your personal needs and situation. So, who should actually consider getting private insurance? If you value speed, want more control over your care, or have ongoing issues like back pain, allergies, or anxiety, a private insurance might be worth the investment. It's also a great option if you travel frequently or want peace of mind in case something urgent comes up. On the other hand, if you're young, generally healthy, and okay with waiting for non-urgent treatment, the NHS is still one of the best public health systems in the world. There's no shame in using it. In fact, millions do. So here's our final verdict. Is health insurance worth it in the UK in 2025? If you value comfort, speed, and flexibility and can afford the monthly premium then yes, it's worth it. But if you're trying to save money, don't have any major health concerns, and don't mind waiting a bit longer, then the NHS will still take good care of you. Ultimately, It's about weighing your needs against your budget. There's no one-size-fits-all answer. Thanks for watching this episode of Global Health Guide. We hope this video helped you make a clearer decision. Let us know in the comments, are you using the NHS, private insurance, or both? What's been your experience so far? And don't forget to like, subscribe, and hit the bell icon to stay updated with honest, useful healthcare content every week. See you in the next video.